Okay, time for quadriceps and patellar tendons.
Now, everything is still the same if we want to scan the distal quadriceps tendon or the quadriceps tendon insertion at the proximal pole of the patella. However, in this case, we generally slide or move a little more distal and sweep through both lateral and medial until we see the entire thickness or width of the quadriceps tendon. So that's how we scan for the quadriceps tendon. Now for the patellar tendon, everything's the same. We simply come up and around and beyond the patella until we're looking at the inferior pole of the patella. And with some ultrasound probes, with some patients, this interval between the distal patella and the proximal tibia, you may actually see the entire distance all on the ultrasound screen at once. Now the area of interest is going to be immediately subcutaneous, and that's going to be your patellar tendon. And the movements are we sweep lateral and medial through the entire patellar tendon. Of course, we also see the Hoffa's fat pad. It's the large area in the center of the screen. So that's how we scan for the suprapatellar recess of the knee, which is where we do a knee joint injection, the quadriceps tendon, and the patellar tendon.
Okay, now let's draw it. So again, patellar tendon. What do we know we have here? So here's bone. That's your femur. We know this is patella. We covered that last time. Cartilage, well, there's some cartilage here. Fluid, well, we know this is a fluid pocket here. To be clear, this is not fluid, this is fat. It looks like fluid, I know. Ligament, well, what connects bone to bone is ligament. Can't really see it, and we don't really call it ligament really, but for argument's sake, we'll call it that. Quadriceps tendon is all this. Muscle, there's no muscle in view. Let's clear it away one more time. Patella, femur, cartilage, not visible, fluid, that's it there. Ligament, we'll call it that. Tendon, here is the quadriceps tendon here. And muscle, there's nothing. Okay, now let's move on to patellar tendon. Let's draw this. Bone. Well, we know this was the, forgive me. We know this was the patella here. There's we've got the tibia. How can I forget the tibia? Over here. Cartilage, there's no cartilage in this view. However, actually, somewhere down here is femur, and you know what, just for fun, we'll put articular cartilage of femur down here. What else? Fluid. Well, we know there's some fluid down here. Ligament. In some places they call this a patellar ligament. We won't draw it though, because that would confuse us a bit, because we're going to call this, our nomenclature here in North America is that this is the patellar tendon. Sorry, forgive me, this isn't playing along very well. There we go. There's a patellar tendon. Muscle, there's no muscle in this view. So let's clear it away, draw it a little bit quicker this time. Tibia, femur, patella. Cartilage, sure, we can put a bit of cartilage down here. Fluid, well, we know on cartilage is fluid. Ligament, no real ligament in view. Tendon, there is our patellar tendon there. Well, it actually comes down to here, of course. Muscle, there's no muscle in view. Excellent. Okay, well, after all that trouble, let's move on to what looks like an alive model.
I'm going to show you how to scan and inject the quadriceps tendon and the patellar tendon. Similar to a knee joint scan, our landmark is going to be the patella, and then we drop on with the orientation of the probe long on the femur, and the area of interest is highlighted by the yellow arrow. If I saw tendinopathy or tearing here, I would turn the probe in short axis on the tendon, and I would place the needle deep to the tendon here with cortisone, Or with PRP, I would go directly into the tendon. The yellow arrow is now inside the tendon. For PRP, now the arrow is deep to the tendon for cortisone. I'll continue on with the demonstration for patellar tendon. I'll now slide distally and get the patella on the left-hand side of the screen. We now see the entirety of the patella tendon between the patella on the left and the tibia on the right. If we were to see tendinopathy or tearing here, I would rotate the probe 90 degrees, and for cortisone, I would place the needle like so, down to the yellow arrow tip, and for PRP, I would place the needle inside the tendon, right where that yellow arrow is pointed now. For distal patellar tendon pain, I would simply slide distally, and I would do the same thing. For PRP, I would go in the tendon like this, and for cortisone, I would go deep to the tendon like this. And that's how I would scan and inject the quadriceps tendon, the proximal patellar tendon, and the distal patellar tendon.
Well, excellent. It's now time for the quiz. Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses, and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfied.